Well, thank you all for having me. It's a pleasure to be here after so long. I've graduated here in 2000 and had a lot of good friendships and good time with my education. And I really enjoyed all the aspects that Christendom had to offer, especially the chapel, growing in my faith, relationships, meeting my wife through Christendom, although she didn't come here at the same time. It's an honor to be here. I feel sorry that I'm the best you have in the area to give you what it is to be a physician. So I'm originally from Canada. I was born and raised there. Grew up in Quebec, spoke French, and had a kind of a good life. My father was a physician. He was a family practice, and most of my experience about medicine came through him. At that time in medicine, things were a lot more communal. Everything was, he was the only thing you really had. So they would come see him, and then he would try his best to do what he could, and then if really need be, then we'd send him up to the next biggest hospital, which was in Ottawa, about an hour away. I got to know what life was as a physician through him. I think a lot of doctors have relatives who are in medicine and get that sense of what it means to be a physician through that day-to-day interaction. It's something that's not always, or is difficult to explain or experience unless you see it. So I'll try my best to kind of, for those who have not had people in the medical field, to have more of an understanding or kind of see what it is to have a day as a physician. But my dad would come and round every morning in the hospital, and occasionally I would be able to see a few patients with him and see the relationship he developed with these patients, and how, you know, a lot of them would be very attached and kind of dependent on him in a way that became admirable, and I wanted to emulate that, or kind of pursue that type of relationship with others in life. I came to Christendom. Initially, I did not really have the drive or that clear ambition to be a physician. By the time I was in junior year, I kind of started thinking, okay, this life is not going to last forever. This is fun. I'm having lots of good times. You know, we would have awesome conversations, but I knew slowly, as I saw some of my older friends graduate and going on to real life and talking to them and asking them, oh, so what are you doing? I'm like, oh, I can't do that job. I would just not thrive. So I started thinking, what is it going to be that I'm going to want to do for the rest of my life? How can I not only feel fulfilled with what I'm going to do, but also what are the things that I enjoy doing? So I started thinking, okay, what are the things that I strive to do? I wanted a job that was somewhat independent, meaning I could do what I wanted to do on my own terms to a certain extent. I didn't like the idea of a boss. That didn't quite happen the way I wanted. No matter what you do, I think that you are just going to have someone who's going to tell you what to do. But at least there was part of it that I felt more flexible in terms of where I could go, what I could do, picking up a job wherever I want in the country without begging or waiting for something to open up. As a primary care doc in internal medicine, you're wanted everywhere, and there are people begging for you to work for them. It's not like that in every specialty, but at least in primary, being somewhat of a primary or hospitalist, that definitely helps. So I started pursuing that, and medicine kept popping up, and I said I would give it a try. So I took a few classes in biology in Shepherdstown, about up on the Potomac here, and said if I did well in biology, then I would keep going. So I kept going. Compared to Christendom, I thought sciences were very easy. And so I decided after I graduate that I would go ahead and start taking my classes. Unfortunately, Christendom does not have any science class. So I had to spend 2 years catching up with my science courses, namely physics, chemistry, biochemistry, organic chemistry, and a few other classes to prepare myself for the MCAT. Took my MCAT, retook my MCAT, and then finally got into med school. And I don't know if it's still like this, but at least at that time, you had to have organic chemistry in order to get in, or all your courses have to be done in order to take the MCAT. And so I had to rush to take all those courses and then take the MCAT to get in. And so I had to take a year off. And so I worked in Alexandria as a transporter in radiology department, taking people from their bed to take x-rays or MRIs, and then finally got in med school, and then went to West Virginia. I spent 4 years there, gradually trying to figure out what I wanted to do. The good thing in medicine is very broad. You can go into surgery, medicine, and then there's other specialties. And each of them has their own responsibilities, their pros and cons, and interestingly, it attracts different personalities. The urologist always seems to have a good sense of humor. And then your psychiatrists seem to be a little mushy, maybe at times. And then your neurologists seem to be like nerds. So, but it's not necessarily the rule, but there's definitely an attractiveness of personalities to certain professions in those fields that you kind of get to see, and slowly you get to pick and choose, how do I fit in? So when I was completing medical school, you get to do, your first 2 years are primarily dedicated to just classwork. So you learn how everything works well with the body in the first year, your second year how everything goes badly with the body, and then the drugs to fix it. Is kind of a quick way to sum it up. And so then your third and fourth year are geared towards the different practices of medicine. And they tend to be 6 major fields are medicine, surgery, pediatrics, OBGYN or obstetrics, psychiatry. What am I missing? You didn't do that?
They didn't do that for me.
No, they didn't do that for you. Oh, that's right. You did it differently. But those, for most med schools, that ends up what you're doing. You do these 6. Oh, and family medicine's the last one. So you spend 2 months integrated doing that, just those. So just pediatrics for 2 weeks or for 2 months. You get to see them in the clinic, in the hospital, and then get to see how you take care of all these different patients. And then by the end of your third year, you have to start thinking about what am I going to do for the rest of my life in terms of what field am I going into. At the time I started planning to go in residency, I had the idea that I would want to become a specialist. And so in order to become a specialist in the medical fields, you have to go through internal medicine. And internal medicine, just to break it up a bit, a lot of people sometimes don't quite know, and if you do, bear with me. If you broke up medicine in 3 primary care aspects, you would have family medicine, which basically takes care of everything, and then you would break it up into 3 compartments. One would be internal medicine, which is for adults, then pediatrics for kids, and then OBGYN for expectant mothers and babies. So in order to become a specialist, especially if you want to do cardiology, pulmonary, infectious diseases, or kidney disease, you have to do training first in internal medicine. So that's the way I went, did that for 3 years. However, by the end, I was counting 10 years. I was getting a little frustrated with being trained and educated that I told myself, I think I'm okay now. I have done enough training, I've done enough education that I don't want to do more. I think I can do this job. And so I became a hospitalist, which is basically anytime people are sick they go to the ER. If they're sick enough that they need to stay in the hospital, the ER physician or the emergency room physician calls me and then says, hey, this person I think had a heart attack. He needs a doc. Can you take care of him while he stays in the hospital? So I take care of him from the moment he comes in to the moment he leaves, and then discharge him and say, hey, follow up with your primary care doc afterwards. So that's kind of my trajectory in terms of how I got into becoming a physician. You know, I think in terms of if any of you are considering going in medicine, sort of. So for those who are, I mean, there's a lot of different things you can do. There's not just, it's a broad field with a lot of different aspects to it. You can do something from administration, where you deal with the business part of things, to be very specialized in doing specific surgeries for hearts or brains that can be very impactful and very demanding in people's lives. You can be pharmacists. I think each of these professions all have their own responsibility. Their training involved in it. Some definitely require less training than others, and then the responsibility of it all. And I think if you're considering to go into medicine, I think the three things I would kind of consider in terms of trying to see if you fit that, obviously intellectual savviness. I don't think that medicine is necessarily that difficult to learn. You do have to have some propensity for science and some calculations, but the numbers, if that scares you, quickly goes away, or you just need some general aspect of math. But afterwards, it's just memorization and being able to recall things when you need to, and kind of build a story or a case to support yourself in terms of finding out what the diagnosis is and then figuring out how you're going to fix it. Things keep changing, so you do have to want to be able to keep up with how to do things. There's not, bad doctors end up being the ones who stick to one thing and think, hey, yeah, this is how we did 10, 15 years ago. It's not going to change. You can't do that. Other thing is that you would want to have in a physician is being able to deal with stress. I think that's probably, of all people who understand medicine, it's the undertone in which all our things are done, and it's how we all, as physicians, we want everybody to understand how much stress we are in. No, it's not that bad. But it is an aspect where, if you are considering it, you have to know how are you able to deal with stress? Is it something that you can, when you take people's lives every day, you do repeated decisions day after day. I go to the hospital, I start at 7 a.m., and as soon as I get there, there's a phone call. And it says, oh, so-and-so's blood pressure is, 90/60. What do you want to do? I don't know, tell me more. And so it could be something simple as they just took too much blood pressure medication, or they're bleeding out. So I have, within an instant, something that's it could go very simply, and as you're answering and talking to the nurse on the phone, you're like, please be something easy that I can deal with, and I can go on with my day so I can go home. Or it can be, I'm going to be stuck in that room for about 2 hours just trying to fix and figure out what's going on, and I don't want to do CPR right now on a person whose blood pressure, send them to the ICU, and then figure out, oh, what the heck happened? Did I miss something? What happened? Should I have given them blood? Should I have given them medication to bring up their blood pressure? What happened? So the stressful environment, you have to be willing to, or be self-aware to know if you can just deal with it. They come repeatedly and in different degrees. Some days I can do rashes, and that'll be fine. I can do it all day, and I'm not going to worry about it. But on another day, I'm going to deal with telling people they have cancer, people that are going to die today or tomorrow, and be okay with it. And I have to be able to say, I'm going to leave all that stress or all that weight here in the hospital and go home, and I'm going to be okay. Because if you can't, you have to still live your regular life and be able to be productive and not be so bogged down by what you have to do. I think the fourth thing that I would kind of recommend in being in the medical profession is compassion. I think that's probably the #1 reason why people want to go into medicine, is to help others. And it's a beautiful thing to be able to, day after day, kind of spend that time with people and be able to say, hey, this is what we can do for you, this is what to expect. There's a lot there that you touch people's lives. It's important times in their life a lot of time, and they really look up to you and are hanging on every word you have to say in order to know, hey, what is going on? What's going to happen in my life? I don't have any feeling in my leg. Is that going to happen for the rest of my life? Or is it going to get better? You know, I can't walk 5 feet without getting short of breath. Are you going to be able to fix me, or am I going to live like that? Or am I going to die tomorrow? What's going to happen? Those are definitely things that they all look up to you. And I look in the mirror every time I'm off for if I'm off for a week or so, and I go back to work, I'm like, oh, how am I going to have to do these decisions? Why are they looking to me to have all these questions answered? What do I know, or what do I? And it feels very surreal sometimes to be the one in that position where it's everybody's just clinging on you. You know, the pros of being in medicine, I think financially is very rewarding. I won't go too much into that, but you know, for the most part, that's definitely something that you get to enjoy, and then I think then you have a responsibility to contribute to others, and you can be a benefactor to others in that sense. The intellectual stimulation is something else that I appreciate in medicine, just being always stimulated and fulfilled in what I do, that you make decisions and or help people, and then you feel that, hey, I've actually done something with my life or for someone else that's helped them then. Independence, I think most physicians feel, especially if you're in private practice, you can do a lot of the things, you can do your own business at the same time. You can be your own boss if you really want to, or you could, if you just want to go and do your shift work, there's things like ER or what I do as a hospitalist. You know, you do shift work where you work for 12 hours and then you leave, you wipe your hands and you can be done. And then you can go a lot of different, I mean, over the country. If I worked in Denver, and then when I wanted to move here, it wasn't that difficult to find a job to say, hey, let's move there. That was a possibility. It wasn't something I had to wait or switch a different career in order to live here. And then lastly, I think helping in others or fulfillment in that can be the biggest plus. I think even from a spiritual aspect, being able to prepare people for death, at their, you know, you can, especially from my standpoint, you get a feeling for it. You can figure out a lot of times when people are going to die, and you have to. I see it as a responsibility to let people know that that's going to happen, because if they're going to meet their Maker, I think they should know and not hide it from them, so that they prepare. This is their last chance they get. So, I mean, I'm not necessarily the best in terms of figuring out a way to convert people on the deathbed, but I do pray for them, and then I try to offer them whether or not they want to see someone, a chaplain or a priest. And I have the pleasure of knowing the parish priest across the street at Winchester. So I say, hey, Father Bjorn can come see you. He's my buddy. Why don't you say hi? But like everything else, there's always things that are stressful or demanding about medicine, and I think the cons of medicine, I think, would be the time commitment. I think, as I described, it took me 10 years to become a physician. A lot of that when people were getting married and moving on with their life, I felt alone and in the library studying, and there was it repeated itself over and over again. And there was definitely, I felt like it was my dark days of my life where, you know, I really had to kind of day after day prepare myself for something else. And I don't think everybody's cut out for it. I don't know how I managed to get by, but I did. And the other side, and once you are a physician, you are demanded to work a lot. There's always work to be done, and there's always the joke around the hospital is that you leave when you can, because sooner or later there's going to be work that needs to be done, and an emergency is going to happen. So you have to be somewhat available to people and be able to tell people, hey, I'm willing to do this. It cuts into your family life, and there's not always there's always activities or whatnot with call that you can't come, you know, whether it's a wedding or a funeral. Sometimes I've had to say I can't go. There's a responsibility I have to do. The other thing would be stress. Like I mentioned before, I feel sometimes as a physician we have a big target on us saying we're full of money, come get us if you can. So there's lawsuits and that happen. We're not perfect, and I've made some errors, and luckily nothing very significant, but they're still there, and you always worry that despite my best effort, despite trying day after day, trying to do something for someone else, I am going to fail. And so you have to be aware that even the little decisions in life can lead to big consequences. Whether it's, you know, someone just has this tiny droop in their face, and you're like, oh, what's going on there? Why are they? Is that did they just eat too much and they can't swallow, or did they have a stroke, right? And then, well, I don't want to order the MRI. I'm about to leave. Do I do it or not? The patient's not being impatient. He's a jerk, and so I don't. Do I really want to take the extra step to do that? And then you can easily find yourself explaining your way out of a situation in which you're trying to say, maybe I should do that, or maybe I shouldn't. So the stress is definitely a part that, one of the cons that I would say be aware of or kind of know what you can deal with. Medicine does not have all the answers. I think, especially in this day and age when there's always a new way of doing things, and I don't know everything. There's always something that people bring up and say, oh, well, what about this oil? Will this help me in terms of healing? I don't know. And I'm not saying that there's no room for that, but medicine as a science is limited and can only answer, I answer it in the sense of, this is what my training is, this is what I'm good at, and this is how I can help you. What is outside of this is out of my purview. You're going to have to ask someone who knows a bit more about that in order to help you. So I think that's kind of, at least the way I wanted to start, and just kind of give you a broad sense of what medicine entails. You know, there's always the patients. It's in the end, it's all about the patients. And so you get the ones that are very appreciative, the ones that are very much in need of help, the ones who are in need of help and don't want it. I had a patient back in Denver who was a heroin addict, and you get to see the side of life that people get into. He had some leg wounds on both of his shins about really big, and they were not easy to look at. And then I say, you don't have any veins that you can shoot in. Where are you injecting yourself in order to get high? He's like, oh, I inject it in my wounds. I was like, okay. And so these wounds were just getting bigger and bigger and bigger, and you see what length people will do to kind of be in their situation. And he says, oh, please don't tell my girlfriend. She doesn't know that I'm addicted. And I was like, how the heck does she not know that you have these large wounds on your legs if you come in the hospital? And even then, despite trying to help them, I mean, he had a bone infection, and so it requires 6 weeks of IV antibiotics. But because they're IV drug users, I can't, and they don't have veins, we have to put a central line in, meaning the vein, or more specifically, it's called a PICC line, it goes all the way to the heart, and so you have to inject it. But they have to be in the hospital for 6 weeks, because if you send them out, they're going to use that to inject heroin. So basically, I had to keep him that long. He got very anxious and decided to leave. But sooner or later, it becomes, those infections then go to the heart, they affect the heart valves, and then all of a sudden they need a new heart valve, and a lot of times, they don't make it. So obviously, there's always someone to fix, and some will be grateful, and some will be appreciative of what you have to offer them, and some of them will be a bit more ambiguous or have other priorities, and then some people will be just nasty. There's nothing else you can do for them. And it's hard to sometimes have to be in a situation where people are yelling at you, saying that you can't fix them. How come you're not doing this? How come my eggs are cold this morning? It can be a bit taxing. So with that, I'll leave Dr. English to pick up. And then we can do question and answers and maybe more stories about medicine.
But in general, it's nice to hear somebody else who's gone through it, because as you come from a Catholic perspective, you come from a Catholic college like Christendom, and you're going into the scientific world in the sense of medicine these days, you are going to be a little bit of a loner. I mean, at least my experience was I was very much alone for much of my journey through medicine, right? And I think he hit a lot of the most important points I think you have to be aware of if you're going to think about medicine as a career. Because you do spend a significant time commitment into it. You do often, and that's why the earlier you think about it, the better off you're going to be. I sort of tried to speed up my Christendom education a little bit. I finished in 3 years here, but again, I had to go on and do a couple of extra classes before I was able to go ahead and get into medical school. And I actually got in before I don't know, it must have changed a little bit because I did my MCATs, or I cheated, I'm not sure which. I got my MCATs done before I had finished all of my pre-medical sciences. I had done organic chemistry. I think there was I only had like 1 or 2 classes left to do, but they let me in. And then so I went over and I went to Sabin University, and then I came back and I went to the University of Pittsburgh, where I went into surgery. And I think often we take what we want to do or where we come from what we see when we actually do an actual experience, right? It's our experiential knowledge of something that leads us or sort of guides our emotions or our passions towards something or away from something. So I had the grace of working with a couple of good surgeons, who really wanted to take care of patients, and they spent their time with their patients, and they wanted to see them get better. And I think most surgeons do, but sometimes they let the stress levels get to them. If you look at the literature, there's up to an 80% burnout rate among surgeons. So there are people who they may have good hearts and things, and it's important to sort of get yourself grounded in something outside of just what you're doing, because if you don't, you can get just sort of worn down, worn thin, and think you can get exhausted. And you'll find out that those people in medicine who sort of have found a way to and I can't say that I've done this entirely, you know. He's got a little more experience than I do. He's been around a little bit longer. But I think everybody who's been able to find that sort of balance has really grounded themselves. I had the grace of working with one surgeon who was a Catholic, and I could not believe the level of patience he had. It was mind-blowing, you know, because they will, like you said, they'll call you, whatever, and as surgeons, one of the things is we're on call consistently, right? So as in general surgery, right? So general surgery doesn't have a shift work. You are, if you're on call, I actually just finished 96 hours of call. So there's this time where you can be called repeatedly over and over and over again, and general surgery is often considered sort of the first line and the last line in much of history and in much of medicine, because if there's something that's going wrong and they need, like bleeding, if something really badly is going on, bleeding or a serious intra-abdominal infection or something like that, the only way to do it is to actually use a knife and get in there and do something about it. Occasionally, it's not all the time, but it is one of the, where it's sometimes the last resort that you have in order to do something for somebody to help them out. So that can happen at 2 a.m. in the morning. It can happen at 1 a.m., 2 a.m., 3 a.m., and 4 a.m. in the morning. You know, and that can be a big, real drainer. You know, it can be a real drain on you. And this guy one time, and this guy was, again, one of the most patient guys I've seen, and we were, you know, and I wasn't actually even on call. That was the great part about this, is one of my colleagues was on call. His name was Pete Allen. I just talked to him this morning. He's going to be taking his boards this Saturday. So he was on call for this hospital. He was covering 2 hospitals. And so he said, hey, you know, John, he called me out, I think it was around 11 p.m. And he goes, hey, you know, yeah, they've got this patient who needs to go to the OR. I said, okay, Pete, you know, I said, I'm stuck over here at Mercy. Can you go help Dr. Garrett was his name. I said, that's not a problem. So I get in the car and he calls me, hey, John, you know, there's another patient. We're going to add him on. We're going to, you know, it's going to be, so, okay. You know, so I get there and Dr. Garrett and I start working, getting into their second case. And they call me again and they say, hey, there's a 3rd case going on. He said, Dr. Garrett goes, oh, okay, okay. So we start the 3rd case and they call again. And they say, hey, there is another patient who needs to go to the OR. And he said, how old is the patient? The patient was 17 years old. And he goes, He goes, 17 still counts as pediatric. Send him to Children's Hospital. So that's the sort of thing that, you know, you can, but he was, again, one of the most patient people I've ever seen. And so I sort of, you know, I don't want to dwell too much because I think he really did hit on some of those points. You know, like I said, you need to you sort of have to have a forward-thinking idea. You do have to have you do have to have a sort of some intellectual interest to continue to pursue sort of what the different developments in medicine can be. For me, it's nice that I have a real interest in what I do, particularly, and that does help. If you're interested in what you do and you're interested in the developments that can happen, you know, for me, it can be pretty exciting because I do, you know, I get to do some things which to me are a little bit more hands-on, and you know, maybe I'm not quite as intellectual as some of the other guys are, but for a lot of what I do, there's a lot of hands-on stuff. So you know, we work with robotics. You know, the guy who was working with Pete Allen, I talked to, he's one of the guys I work with a lot. He was an engineer, and so he's developing, you know, different stuff in that realm. You know, I did a lot of robotic stuff, and then we also do laparoscopic, and we do, you know, a lot of surgery. But we also have to know that we can't forget about everything that they're talking about, though we do lean on them. They are, you know, they help us out an immense amount, and despite the fact that, you know, I used to go down in the, sit down in the lounge down where all the medical residents were sitting, and they were not very complimentary towards surgeons all the time, you know. And I understood it, because if I went up to the call room and I sat down with the surgeons, they were all saying, you know, what's wrong with that medical guy? And really the idea behind it is you really want to foster a camaraderie where you can really work with each other, because it's very hard sometimes to see something from someone else's perspective. And I found out in medicine, you see a lot of people sort of in vulnerable states. You see people as they are as human beings in some of ways that they wouldn't necessarily show themselves to other people. And because of that, you realize everybody is human and everybody is not perfect. A lot of us are striving for perfection. A lot of us fall short, you know. And that's one of the beauties about what we do, is that, you know, we are always working to improve ourselves, but as, you know, Dr. Jansen mentioned, we are doomed to failure. You know, and so when if you look at just real briefly, my history, you know, I was a homeschooled Catholic school, I went to boarding school, and then I was in the seminary, I was a novitiate briefly, you know, and then I came to Christendom almost by chance. And The good thing about Christendom is it gives you an opportunity to sort of ground yourself in reality. You'll be surprised how many times you're out there and people have no idea about teleology or human nature having a due end. The good thing about medicine is it's hard to deny that, so people tend to have some sense of purpose and purpose-driven. But there's a lot of lack, and I think if you're, you really need to have some sort of foundation from which you can build on, and that gives you the opportunity to really go somewhere. So, I would encourage everybody, to sort of think early about what it is you want to do, and then just if you are going to consider medicine, just sort of remember sort of what Dr. Jansen said about those different, stressors, the pros and cons that come with a role in medicine. There are a lot of pros. You do get to have very fulfilling work. If you want a 9-to-5 job, there's nothing wrong with it, and you can find a lot of fulfillment in doing that and having a family life. And often you count your blessings. I have a lot of friends who have, sometimes you look at them and you might even be a little jealous, because they're relaxing or doing something. I miss my brother's wedding. And it's nice to hear that other people have had similar downtimes, but there's also something fulfilling about medicine, and it is that opportunity to really touch somebody, or to make a difference in people's lives. So I don't really have a whole lot to add to the pros and cons of what he said. If you were listening, and I sort of reiterate that, to have that in the back of your mind, and then to sort of consider, well, what can you do? And like he mentioned, there's a broad thing in medicine. Not everybody has to do what what I do or what Dr. Jansen does. There are ways. You can do shift work, you can do prolonged work, you can have lighter or heavier workloads. But in general, in medicine, you have to at least have some degree of work ethic, because you are going to be asked, to run a marathon really at some point. This is not a sprint. So you can have some brilliant. I worked with. I'm just going to share this story because it came to me and it really irritated me at the time. I had this. At the University of Pittsburgh, there were 2 tracks. There was a 5-year program for general surgery and a 7-year program. The 7-year program, included 2 years of research, which I was not interested in. They tried to get me to do psychology. I usually say most psychologists need a psychologist. But it's not always true. We know some good ones. But they tried to get me to do research in psychology. I said, absolutely not. So then in medicine, I said, I'm only doing a 5-year program where I get to do work. I'm not doing this research thing. And I worked with somebody who was a seventh year resident who was an absolute genius. They were a genius. And then they sat down the robot and they had no idea how to operate it. And so there are different places for different people in medicine, right? And those places can be very diverse. They can give you an opportunity to do a lot of different things. And you can work different levels. If you want to work your ass off really hard, you can. My dad ran a private practice and took call by himself for years. I said, I'm not doing that. So that's why I sort of ended up with working for, there's a lot of independence, even when you work for a boss in medicine. Your decisions are your decisions. They're not, your administrator's not going to come to you and be like, no, I don't think you should cut there. That's a bad spot. He's not going to tell you that, right? Now your chief, the chairman of surgery, when you're a resident, will yell at you not to cut there, but that's another thing. So I'm going to sort of leave it at that. I don't know if you guys want. I can share. I have a gazillion experiences in surgery. everything from I did trauma, vascular, cardiac surgery. I've done just about almost any surgery except for brain surgery. I don't like brain surgery, so I stayed away from them. But I've done almost, I've been involved in or done almost any surgery in the book. So, I'd be happy to share experiences with that, but I really wanted to give you guys an opportunity to sort of express what you want to think about, or even from an abstract standpoint, just going into the workforce, or going into medicine. So I think I wanted to go ahead and open it up to anybody who wanted to have thoughts or questions about what we do, or if you want to know whatever you want to know. If you want to know about what I've done, if you want to know what Dr. Jansen's done, or if you just want to know what we thought about as in order to get into work, so that those practical points of how am I going to provide for a family, how am I going to get married, and I will tell you it does put a little bit of a put some strain on your on your family life. It does, and I'm blessed to have a wife who suffered for 5 years at least, and probably is going to continue to suffer. But she also might just get me to heaven, so it's, you know, it's a good thing.